let's jump into the topic. Number one is well-being today is still only 1 in 10 employees worldwide has a corporate well-being platform. This is from our client Aon, where we are their global platform. So you can see here in Asia, where we are today, is 5%. So there's a huge upside for what I call corporate well-being. And the overall strategy, we care. So the healthcare operators, we launched hashtag We Care Dakadu. We just made it to the front cover of the global Microsoft magazine called Pulse with millions of readers, because we very early on told the operators, you need to go, we care, you need to show that you care and that you take this very serious. So trend number one in the wellness industry, big growth industry. And, Asia, you are in a very lucky position because there will be very strong growth ahead. If we look at the classical insurance industry, they were what I called assumers of risk. So you had the life industry, you had accident and disability, and you had, the typical healthcare industry. So it has all been about, looking back in time. Those are called life tables, trying to predict what kind of diseases will happen and how do we price the future. I think going forward, with all of us getting older, both my parents are alive, up in their 80s, we will just get older. And, we would probably go through, I think, the next 5-10 years with a relatively low fixed income. So the returns on equity will be lower. So we simply have to adjust the system and mend in a positive way. So I think the 3 growth drivers for both the payers and the providers is trust in we care. So why do I call it trust in we care? The most important now, as we see with, the crazy elections in America and everything, that we show society we care about them. So this is both a role for the operator and, of course, for the payer. Number 2 are well-being products. So really a consumer-driven, at Dakadu, I call it the ref factor. So being relevant, easy, and fun to be in business with. And last but not least, the platform economy. And I don't want to get too technical for the audience today, but a single sign-on experience, a smart triage. So, really a very user-friendly platform economy. So this prevention of risk, and the crazy thing is, according to WHO, we spend about 1% on prevention globally, and we spend 99% fixing the problem. So the system is, completely out of control. I'm a big believer, as you know, in sustainability. I'm a big supporter of the UN and, Red Cross, Doctors with No Borders. And here you see, of course, the UN Global Compact principles. And you see that principle number 3 is great, or, I say great, they say good, but I say great health and well-being to everybody on the planet. And that's obviously why I founded Dakadu. Before that, I spent 10 years doing sustainability rating, so looking at carbon emission, carbon trading, water usage, etc. I'm a big fan of Professor Dr. Carl Pearson, who was a British mathematician and biologist. So we're seeing now those digital biomarkers, coming together. What does that mean? And, he said, it's about 150 years ago, he said, what you can measure, you can improve. So basically creating a proxy of wellness, a proxy of life, which is the health score. So that becomes the North Star. And if I can understand something, I'm 55. And now I know that the average health score this morning, I checked just before the call, in Zurich, in Switzerland, was 569 for the 55-year-old. Then I can compare myself and see how am I doing as a 55-year-old to the other people living. And in Zurich, we're about 750,000 people. So basically, if I can understand something, I can follow it, and hopefully I can grow with my personal potential. Now, healthcare operators, both on the life side and on the health side, and the overall operators, has not been world famous for their client integration. This is from Kempken. It's a leading investment bank in Europe. They did it, as you can see here, together with Harvard and Swiss Re. So basically, they say a life insurance has 2 touch points per year, and a health insurance has between 12 to 15 touch points. And that's, of course, the monthly bill. You go twice to the doctor, maybe once, to the drugstore. You get the point. It's a very static economy. I am not saying that the healthcare providers, should have contact with me 400 times per year, like a Facebook, like we see at the end of the scale. But I definitely believe that the health economy and the operators, both on the payer and provider side, they should get up to 50 to 70 touch points per year. So, that they become relevant. You remember before what I called the ref factor. The biggest cost factor to society, and I'm not a skinny guy, everybody who knows me around the world, is, of course, obesity. And I just want to put 2 minutes. This is from the Financial Times. So you see there on the right that obesity in the fast-growing, developing part of the world has grown sevenfold over the last 45 years. Sevenfold. So I was backpacking in China when I was 19 years old. I didn't see a frozen pizza. I didn't see a hamburger. People were on bicycles, etc. Today, when I come to China, and I spend a lot of time in China for Dakadu, is frozen pizza, obesity, coffee with 7 times sugar. Of course, I'm over exaggerating, but we just have to think about the McDonald's, the Starbucks, etc. What are their role in this whole obesity society? The reason that I show this slide is the Western world. So, what some people call the old world is also in big trouble. You can see here, obesity has increased with 300% over the last 45 years. And with COVID, as I mentioned before, 85% of all the people that passed away had one or multiple chronic diseases. This is from AIA in Hong Kong. And you can see here, they say 4 factors. So physical inactivity, and God, with COVID, we all sit in this stupid chair, 12, 15 hours per day. Unhealthy diet, so fast food, smoking. And again, smoking is on the tick up again because people thought, it's healthy to smoke these new smoking systems. And then, of course, you have the excessive alcohol intake. So what am I getting at is those 4 behaviors, they create 80% of the disease burden in this world. So diabetes 2 has nothing to do with that you inherited it. Diabetes 1 is, of course, a terrible disease that you inherit, but diabetes 2 is pure lifestyle disease. We have respiratory disease, we have cancer, we have cardiovascular. So this creates 60% of the global death before the COVID and 80% of the cost burden. So my view is that the healthcare operators, they should take a preventive approach instead of just paying bills. And I used to be on the board of Rothschild, who took, a few telcos public, back in the good old 90s. And at that time, I always told the telcos, don't become a stupid fat pipe that only transport voice and data. And we all know they could have become Google, they could have become Netflix, but they didn't. And that's why I'm saying to the operators, if you want to follow the telco industry, be my guest, but I don't think it's very sustainable. When we look at the overall economy, I call it KYC, or it's becoming a standard KYC, know your customers, So basically, there are 4 trends that no healthcare operator will get around. Number 1, it's about powering the platform economy. McKinsey says by 2025, it's an easy number to remember, that 25, not billion, trillion dollars will flow through the platform economy. And on the health side, it would be $10 trillion. So the largest part of that, 25 trillion will flow through life and health. Number 2, it will become health tech driven. I know that many people are saying, how can IT guys like myself move into healthcare when we haven't studied medicine? And I completely agree. I have my own doctors and everything. But it is this, what we talked about, you and I, before we started this session, it is about the biomarkers. It is about, the digital biomarkers. It's about computing power and, AI coming closer to each other. That brings me to the 3rd trend. I'm a big believer in ubiquitous IoT. IoT stands for Internet of Things. I had a chip in my shoulder this summer, and not because I want to be high tech, but I wanted to read, the behavior of my blood to see if there's a correlation to the health score. So basically, in a few years, we would just have a chip you put on the hand. It would read the acidity of my skin. It would take my blood pressure, my sleeping trends, etc. And I won't even feel that I have this little nano plaster sitting on my hand. That brings me to the last trend. it is what I call the something for something economy. Why would the consumer participate? And you remember how I started today. I said, we care, the trust in we care. So we need to show the consumer we really care about you. And that's the health monetization model. Why should I share my data, look after my health, if I don't get something in return? Now, what are we looking at today? We're looking at 3 trends, if you ask me. We call it, connect, score, and engage. So basically, the healthcare system needs to connect with the consumer. And I hope you will recall that I spoke about mobility before, so that I can automatically, book the doctor over my smartphone. I'm walking on the street, I have fever, it gives me the next best, just the same experience, from e-commerce or from travel or entertainment. Number 2, provide me with something I understand. That's the score, right? So the proxy of your life moves. I've never met anyone who doesn't understand the health score, and I will get back to that in a few seconds. And last but not least, the toughest part, and here we are working together with leading British professors, is the whole engagement. How do I continuously engage people with their health and, looking after themselves? And this is important both for the payer and it's important for the provider. So basically, in our world, the health score is based on 3 legs. And you remember Da Vinci, good old Da Vinci 530 years ago, said we consist of 3 things. We consist of our lifestyle. So this is how we eat, how we sleep, etc., how we move around. Number 2 is our mind. So our mental well-being. Us men, we are not so good in this stuff. And I have 5 daughters, so I have a lot of minds. And I'm just joking. And then, of course, you have the body. So he said, the body matrix, your blood pressure, your body temperature when you sleep, etc., etc. Now, the user, they don't want to understand, 10,000 biosignals. They just want to understand, am I good or am I bad? Everything below is multifaceted, right? So that comes later. But in principle, in our view, a human life wants to have the longest possible life with the best possible outcome. I don't believe anyone wants to spend 10 years in the hospital and being ill. I don't think that's a goal for any human being. On the insurer side, they want to have engagement, because if they can engage with you, they can price and have a better product offering. Today, it's a, finger up in the air, how's the wind blowing? And then they try to, find the best possible price. Now, for the healthcare operator, we believe the health score is unique. The health score, as you know, was founded by us in 2010. We have filed over 110 patents, 28 are granted. We both have a baseline health score with 4 data points. So your height, your weight, your age, and your gender. And then we use imputation with over 100 data points behind. Today, our insurance clients around the world have over 200 million lives under contract, and we have scored over 300 million man years of clinical data. So we believe that both on the provider side and the payer side, that we are extremely well established. Now, when we go forward, and this is really one of my favorite topics now, is what I call the wheel of insurance. And I would explain why it's important for the insurance industry, and I'll explain why it's important for the provider industry. I believe that if you look at life industry, insurance industry, they have a lot of capital, right? So they are very well funded. If you look at the operators, they are always, missing the last few million for the latest, gear, etc. So basically, I think they will get closer to each other. We saw it in America with CVS acquiring Aetna, etc. I believe that's just the beginning. I wouldn't be surprised if Walmart, suddenly swallows, a big, health provider, etc. So I think we're going to see some big movements. So I call this the wheel of insurance. You could call it the wheel of life, whatever you want to call it. But basically, we are seeing this whole health score engagement on one hand side, which would become important to retail, to the providers, to the travel industry, etc. So new ways of customer engagement. On the payer side, it's all about improving the capital management, as I said before, creating relevant products, etc. Now, you may ask, I'm an entrepreneur, so I also like to tell people what's coming in the future. When I look at my own life, I started, back in the 80s with databases. We built Sybase into one of the largest software companies in the world. Then I went into business process reengineering, sustainability, and then, of course, now the digital healthcare industry. Going forward, if we look at the next 5 to 10 years, I believe augmented reality will become very important for healthcare, and I will explain in 1 second. And I believe that holograms will become very important. I'm sure you all saw the new, we're filming a bit earlier here, but the new iPhone was announced yesterday, and it has the new sensors. So very soon you can stand in front of your smartphone and you all understand. You can do exercising. You have your hologram telling you, Peter, do push-ups, Peter, do those dance moves, whatever you are interested in, yoga movements. And you will have the hologram talking to you. You will have Dakadu being voice-based. So the coach tells you, Peter, come on, you can do another 5 push-ups, that the sensor will see, am I doing the movements the right way that the coach is telling me. So basically 5G will enable, of course, the augmented reality and the hologram. And a lot of people, I've been in telecommunication all my life, they ask me, why do we need a 5G? Isn't 4G good enough? No, it's simply not, because we need the bandwidth and we need the performance out of the multimedia experience. So going forward, number one, the ref factor will become a global standard. If you are not relevant, if you are not easy, and if you're not fun to be in business with, guess what? You will not survive. And being an entrepreneur, I'm not the guy who talks friendly to people. I'm the person, who says what, I think and meant in a positive way. So I don't care if you are with Dakadu or with anyone else, you need to have a ref factor and you need to benchmark that ref factor in a digital economy, both as a payer and as a provider. So number one, you need some kind of unique proxy. We call it the health score. You could call it whatever you want. Number two, it would be an AI-based coaching world where the coach right now is, of course, bi-directional, let's call it messaging service. This would become voice-based. This would become, as I said before, augmented. And then, of course, it would become hologram-based. Gamification. We have been gaming for over 3,000 years. If you remember the old squares in Greece, and I'm not making fun, they had the stones, and the old men would meet in town and talk about the situation, and they would play the stone game, and each would sit on their stone. So gamification is nothing new to mankind. Points and rewards. I personally don't believe a consumer does anything without getting something back. So we need to get the operators into what I call the something for something economy. Now, a topic that I'm really big on is data privacy. And I know many insurance operators don't have my view, but I'm a big believer in data privacy. The consumer should own their healthcare data. And this is why we created the health score. So we separate the health data from the health score. There's a Berlin Wall between. Doesn't matter what wrong buttons you tick on, nobody would ever see your healthcare data. So I'm a big believer in encryption at rest, encryption at transfer. So when you transfer between hospitals, when you transfer between, insurance operators. And last but not least, I'm a big believer in private social networks. I don't want to share my healthcare life with 2.5 billion people on a social network. And you know that I'm making fun and over-exaggerating. So we are a big believer in the social network. Does it work? Yes. Here's an example of 2 years of, one group, and it's just from one group of our clients. So 64% have improved their health score after 12 months, and 90% improved their lifestyle. 73% said they felt more in balance with themselves. And 63% have either lowered their blood pressure, their risk of diabetes 2, etc., etc. Now, going forward, where will the industry go? It will become AI-based, as I said. So we have programmed in over 4,000 different rules around stress, depression, weight loss, smoking cessation, etc. Number two, I don't believe in a few years you won't sit and tip in everything on your smartphone. I'm a big believer in voice. We are not there yet. If I use voice and my dog starts making noise in the background, I fully understand it, right? Something crazy. And voice-based email, etc., is not there yet, but it will get there. I'm a big believer in what I call distributed ledger. I don't use the word blockchain. I use the word blockchain here because people understand what it is, but a distributed ledger that you understand where the data is coming from, who is the owner. You remember my privacy issue before. I believe wealth is closely associated with health. I believe location is very important. It's obviously, and people don't like to talk about it, but if I grow up in the middle of Mumbai, my life expectancy, unfortunately, based on the air quality, and as you know, I'm a sustainable thinking person, is lower than somebody who grows up on the countryside in the UK. Content gateways, you remember that I talked about the platform economy. So I think, I call it JSONification. So, HTML was the way of doing documents on the internet. JSONification is, of course, exchanging JSON documents in a very, configurable and highly powerful way. I thank you all for listening to my presentation today. I don't hope it was too boring. I believe with COVID, it's full speed forward. Dakadu is growing very, very nicely. And I believe that people have finally realized that prevention is the future of our industry. Thank you so much for listening to me today.